Medications or psychotherapy. Okay, now what I want to tell you is that something you probably already know, but if you look at head-to-head comparisons, psychotherapies versus medication treatment for anxiety disorders across the board, psychotherapies are better, they're more efficacious, and when people improve, they tend to be stable. There's less likelihood of reoccurrence. Okay, it's not zero, but it's more sturdy over a period of time. Medication treatments, a lot of times medication treatment, when it's very successful, you take the medicine away, the symptoms come back. Okay, so it's here in the area of anxiety disorders that medications oftentimes, rather than fundamentally changing something in the brain. Remember, depression increases BDNF, the brain can heal itself in some respects, but with anxiety disorders, it's much more a matter of reducing symptoms. Now, having said that, I need to qualify this, and that is the treatments that work, the psychotherapies that work, almost across the board are cognitive behavioral therapies that have exposure components to them, okay? And secondly, probably stating the obvious, there simply are a lot of people that don't have access to that kind of therapy, okay? Generic talk therapy can be helpful, but is not nearly as effective as the cognitive therapies. And there are many places around the country where lots of therapists say, oh, I use some cognitive techniques, but that's not what I'm talking about. Most of these, like especially panic disorder and OCD, the good results are if you do it by the book, okay? And a lot of places, they don't have therapists who really do the real thing, systematic, structured cognitive behavioral interventions. Secondly, is a lot of these interventions require exposure, and when people find out about the fact that they have to get exposed to the things they're afraid of, they say, forget it, I'm out of here. In some studies, post-traumatic stress disorder, even in the hands of experts, you have up to 50% of people dropping out after the first session because the therapy itself is re-traumatizing because they talk about something that scares them too much. Okay, and then finally, there are just lots of people that say, I don't want to see a shrink. I don't want to go to psychotherapy. So I just want to acknowledge that, again, you look at the research, head-to-head comparison, psychotherapies are better, okay? But in many instances, people don't have access to that kind of therapy or they opt out of it because it's too frightening. Now, let me say one more thing about this, the either-or thing. How about both of them? And if you have anxiety disorders, and let me just use as a very simple example of phobia, a simple phobia, okay, fear of heights. If you do aggressive medication treatment, you can squelch anxiety so much that a person can walk out on Golden Gate Bridge and not freak out, okay? And they can go out there and they can do it every day, 365 days a year for a year, and on the medicine. And then you take them off the medicine and they go out there and they freak out, okay? It is state-dependent learning, and that is when the drug is there, it reduces anxiety enough they can expose themselves to whatever they're afraid of, but you take the medicine away and the fear comes back 100%. So practically speaking, for lots of these disorders, the name of the game, and this has been, I think, largely what I've done with clients I've seen, if they have very severe debilitating symptoms, and panic attacks are horrible, and very severe OCD is horrible, sometimes the first thing to do is to go in and do aggressive medication treatment and put the fire out a little bit, okay? Get them functioning, back on their feet, and then you introduce the psychotherapy. But as you begin exposure-based therapy, what you have to do is you have to, at some point, begin to reduce the dosage of the medicine because you can't have extinction without experiencing some anxiety. Everybody with me on that? And what that's going to mean, for many of you, if you're doing work with primary care physicians, is helping them understand that there may become a point in therapy where it's going to be necessary to reduce the dosage, not cut it off entirely. You want to titrate the dose, but so that you can begin phase 2, which is the psychotherapy part of it, where they have to feel some anxiety. Okay?